Hi everyone, welcome to Friday's report out. Good to see you all. We'll probably have colleagues joining us as we go along, but I'm delighted that we've got two really good report outs today. First of all, we've got the implementation of Bookwise in children's outpatients, which I had the privilege of seeing firsthand, meeting the team and seeing the great work that's going on and the impact that that's already having. And it's good to see, I can see you, Suzanne. So without further ado, Suzanne, I'll hand to you.
Thanks, Julian. Thanks, everybody, for letting us come along here today. So I'm here with myself. Hello, I'm Suzanne Abrahams. I'm the General Manager for Leeds Children's Hospital. And Sandra Garbutt, who is our Senior Sister for Paediatric Outpatients, is also joining me as well. So we will take you through our journey of how we secured Bookwise and implemented it within the Children's Hospital at Leeds. Just move on to the next slide. Hi, Sandra.
Good to see you.
Hello.
Hiya.
Lovely. So in terms of what our problem was, so it's a tale as old as time, really, in terms of paediatric outpatient estate. We have a defined outpatient estate within the Children's Hospital, but it was underutilised. When people wanted to book outpatient additional clinics, they found difficulty in doing so. It wasn't very clear what was being used, when it was being used, and more importantly, what was available and when it was available. We had rooms that just went to waste because people thought when there's a usual clinic that takes place that it wasn't available, but then people were on leave, the room was available and was available to book, but nobody was able to do that. So opportunities were really wasted in terms of when we could have run additional clinics and additional capacity, but just weren't able to do so simply because of the estate restraints. Poor Sandra and her team spent an inordinate amount of time trying to manage that situation, because obviously the confusion leads to a lot of wasted time during the day, a lot of queries coming from all kinds of people, be that patients, families, clinical staff and administrative staff, and people like me as well wanted to know what's happening and why the flow of patients is as we would have expected it. And a lot of upset people, and that in turn takes its time, that Sandra so brilliantly dealt with for years and years, but it was an inappropriate use of her skills and resource. A lot of confusion within the admin teams, people once again not knowing what was available, who'd booked what and why, and again that just was a really laborious way of running things, and it did lead to a lot somewhat of a problem with conflict amongst the teams, that where people got very territorial about rooms, and then when people thought they'd booked a room and didn't, and then somebody else wanted it on the day, kind of operational issues just like that were not a thing that were out of the norm. And again, poor Sandra was having to referee those kind of conversations on a daily basis. So we absolutely needed to do something about this, and I'm sure anybody who's involved with outpatients across the organisation, and anyone who I've spoken to in any other organisation across the country will recognise and be able to relate to these issues. Thank you. So what did we do? So I consulted with other children's hospitals across the Children's Hospital Alliance. We're part of a Children's Hospital Alliance as part of 11 specialist children's hospitals across the country. And I wanted to know if this was something that was happening. And I was, as I've just said, I was assured that it absolutely was. And what were other places doing about it? People had various different companies that they worked with, but they all tended to have an electronic booking system. I then met with various providers that were being used across the different children's hospitals. We then brought those kind of options back, discussed it with the team, and it was very much a multidisciplinary team, not just the admin team. We had some clinicians involved, nursing staff, and Sandra, of course, was part of that. And together we agreed what the way forward, which provider we wanted to go for. And then I was tasked with securing the funding to enable us to do that. It was about £70,000 in total, but by hook or by crook managed to secure that, and it was one of the best things we've ever invested in. I have to say, the bang for your buck in terms of what you get value for money is second to none. And once we got the funding, we absolutely went for it, full steam ahead. Thank you. So what did we learn? So essentially, in terms of when we said we went through it, what did we do? We procured the system, and then we worked with the company to understand how we needed to implement it. And there was an awful lot of learning along the way. Bookwise is an electronic room booking system. So essentially lets you see exactly what you have in terms of your rooms, what they're suitable for, what kit is in there, and it tells you what's booked and what's not booked. And if I wanted to run a clinic a week on Friday, I could go onto Bookwise and see if there was a clinic room that was suited my needs that was available. And if it was, I would book it. So that's the system in a nutshell. In terms of what we learned whilst we built it, building the system was a huge piece of work and something that none of us, I think, really understood how big a piece of work that would be. It requires having to understand what things run on a daily basis, a weekly basis, a fortnightly basis, things that run ad hoc. You have to understand what kit's needed for each kind of clinic, etc., etc. So it was an absolutely massive piece of work. We had to link in with the clinic rescheduling team, which was a team that sits within Outpatients, so out with the Children's Hospital, but they were fantastic in working with us and working through any issues. We had to work through all the clinics that were already cancelled on PAS and that weren't on Bookwise. So again, just doing all of that kind of housekeeping and introducing fail-safe systems to make sure things weren't missed as we went along. Consultants were missing, clinics were missing, lots of things weren't as they should have been. But as we continued to build it and took the right amount of time as well to build it, the accuracy improved, and we continue to do that. I'm sure Sandra will attest to on a daily basis. When we first started this, we met daily, and it went to every other day, weekly and fortnightly, and we really do continue. We had a meeting this week to feedback the lessons learned and see how we can refine it even more. We developed a learning log so we could share our learning across the piece, and when this is rolled out to adults, we will absolutely share it with our adult colleagues, because there's a plethora of information we've been able to obtain as we've implemented this. The biggest learning part, I would say, is that no matter how much you do, it will still be wrong. And we absolutely were open and honest about it. And I continually said at all the meetings, when this starts, it's going to get worse before it gets better. So I think managing people's expectations to that. So when it did get worse, people weren't of the opinion it's never going to work. We were expecting that. We worked through the issues, we learned from them, and we were able to move on and improve the system. So as I say, we went from the daily to the monthly meetings we're at now. Just keep communicating constantly. This isn't a perfect system, but it's so much better than it was, which again Sandra will talk to. And we just keep talking to each other, and Sandra lets us know when things are working really well, and she lets us know when it's not working so well, and we go away and fix it and make sure that that same mistake isn't repeated again. And I think that's the most important thing. It's a totally collaborative effort, and we just keep going, but we keep going together. Thank you. Sandra, over to you.
Hello. Well, as Suzanne said, we did expect problems. To start with, I thought this isn't going to work at all. But I've been pleasantly surprised, and I think my team, and we're only a small team, are pleasantly surprised. One of the big things that used to happen, I would get phone calls day after day after day, sometimes several times a day, and more emails than you can imagine asking for extra clinics. Well, we're a big area, and to look through every single clinic that's running on every single day to find somebody a space was so time consuming, it was impossible, to the point where occasionally I have to confess I used to ignore the emails because it was too much. That doesn't happen anymore. I just refer them back to the secretary, who looks on Bookwise, and the clinics are booked or not booked if there isn't a room, which is great. People are so much happier with it. And one of the biggest bonuses, people sometimes would still book a clinic regardless of whether there was a room available or not. They'd just take potluck. Now, because of Bookwise, we don't ever not have a room, which is amazing, because with 30 rooms, to not have enough rooms to go around was soul destroying at times. Don't ask me how, but sometimes we worked miracles and I'd have to throw people out or share rooms almost, but that doesn't happen anymore. The rooms are there. One of the other things that happened over the school holidays, because it's a children's outpatients, historically, we were always much quieter of the school holidays, and we always had space. And we noticed this last school holidays there wasn't, because people are now so used to using Bookwise that anyone who was available and to try and catch up post-COVID, extra clinics were booked. So we were busy throughout the school holiday period. So all in all, it's a win-win for everybody.
Thank you, Sandra. If we just move on. So as Sandra just said then, I think that's the proof in the pudding, really, because the half of this project was trying to improve Sandra's working life, because it was so difficult. And in terms of how it's improved things, Sandra just spoke really eloquently then about that. But one of the biggest things as well is that we're managing to see more children, and this is what it's all about. So our pilot began in February 2022, and we were delivering at that point 788 clinics in the month. In September 2022, we delivered 998 clinics, and that's a 27% increase. So we're delivering just over more than 200 clinics a month, which equates, in a conservative estimate, at more than 1,000 extra children's outpatients a month. And that's 1,000 extra children and families who are getting seen, who aren't sat at home with parents and families worrying and fretting about what's going to happen. They're not ringing up there, and they're putting additional pressure on the administrative team and the telephone systems and RBS asking what's going to happen. And I just think it's fantastic, and we're still on really early days, so the system continues to go from strength to strength. I believe that we're rolling it out across the organisation, across adults. I'd be more than happy to help in any way I can with that, because as a citizen of Leeds, I want us to have this as a organisation in case I ever have to use the services. And I just think it's absolutely wonderful. I told Julian this anecdote when he came to meet the team, is that the second I knew that this was going to work was when one of the consultants on a particularly busy day said, oh, I just want to go and hide in a cupboard, but I've not booked it on Bookwise, so I know I won't be able to. And that, when I heard that, I thought, yes, they've got it. So it's really worked out. It's been a tremendous success, and I'm really pleased to be able to share it with all of you. Thank you. Thanks, Julian.
Great, excellent. Thanks very much, Suzanne. Thanks, Sandra. That was great. Really helped bring it to life, and great work. And yes, indeed, looking forward to seeing what we can do, obviously, around expanding this approach trust-wide. So what we'll do is we'll hold questions for the end. So let's move on to our next report out, which is our great team from Estates and Facilities on recruitment. It's a 30-day report out. So guys, over to you.
Thanks, Julian. I'll kick us off. So hello, my name's Sophie Williams. I'm the Operational Improvement Lead for Estates and Facilities, and I also work in the KPO team. Since February this year, I've been working with the teams on streamlining processes for Estates and Facilities recruitment. This is our 30-day report out following several Kaizen events over the summer. So the scope for the improvement in recruitment was huge, but we needed to start somewhere. The team wanted to reduce the lead time for new starters, specifically coming in to facilities technician roles. So that's our porters, cleaners, caterers, as they're the real lifeblood of our services. We thought it was important to start there, as we hire about 300 new facilities technicians every year. This number increased during the height of the pandemic, and a new COVID bank system was adopted. So during June, July, we tested a new streamlined recruitment day that the team were keen to implement. The Kaizen team came together on multiple occasions and used Leeds improvement method to understand problems. They mapped out the future state and worked on how to communicate better as a team. The Kaizen team consisted of operational managers and supervisors, organisational learning and organisational development, the recruitment admin team, the central resourcing team, a porter, James, who can't be with us today, unfortunately, and our lovely patient partner, Dolph. And working together, we really started to break down barriers that have meant the team can produce some great results, and they've learnt lots. I'll now pass you over to Martin to share some of those results.
Hi, good morning. My name is Martin Lowe. I'm one of the process owners for the operational facilities team. We've been continuously working on the remeasures as part of this project, and currently, as the slide shows, we're at a lead time of 56 days from a starting point of 98 days, which is almost a 50% reduction, which is a significant impact in the recruitment process. We did hit a recruitment lead time of 49 days, and we're currently looking at the factors that have led to that slippage. We believe that that's due to the reintroduction of cohort recruitment, which was an unremovable duplication because we had to have the cohort recruitment starting whilst we were already converting existing COVID staff. Significantly, it was also the main summer holidays where applicants weren't available and our own staffing weren't available. And there's obviously resource demands that go with that process. As this process continues, we're continuing to hold regular development huddles to update and develop solutions to the problems as new systems are developed and tested and embedded. We can see the positive impacts from the amount of the defects in process being reduced from 25% now down to 12%, which again is a significant factor. The defects currently are being identified as staff not bringing the right ID for onboarding and not signing up to the DBS update service in a timely manner. This is something that we're continuing to work on. As we continue this journey, we will continue to monitor and measure and review for continuous improvement what it is that we're doing. As we get the first groups of staff that start with us via this new process, we will be reassessing their view on the process to see that this works for them as an experience as much as it does for us. Okay, on the screen now is a chart, and it's something that we've worked on as a full multidisciplinary team, and it's about streamlining and mapping out the areas of responsibility at each stage of the process. And this will help to identify where there's been gaps historically and where the various different teams have assumed or believed that others own that part of the process. So it will help make things move more slickly. As we run more assessment centres and more recruitment processes, we're getting better and better at this at each time, with greater and greater levels of detail being explored. The grey areas in the chart are those areas that we are still working on and still finding solutions for. I now pass you over to Claire.
Hello, my name is Claire Flanagan and I work within the operational facilities team at St James's, and I'm a process owner for this work. The Kaizen team wanted to gain feedback from the candidates and the management team on the recruitment days to allow for continuous improvements. The blue speech bubbles that you can see represent the candidate feedback. And as you can see, there are lots of great comments around coming onto site. The walkabout on the wards and departments were invaluable to gain an insight into the role they were applying for, which was a way for people to meet other candidates who they could possibly be working with in the future if they were successful. The green represents the management team and how they felt that the day went. And again, we received some great feedback. The team's feedback from the recruitment day was overall positive. They all agreed that it was a great way to be able to see people face to face and that all candidates seemed to be more engaged in the process. The red feedback bubbles represent the areas to improve on and were mainly around the venues, the location of the rooms and the IT availability. Work is ongoing on these areas to improve this. As you can all imagine, obviously finding venues at the moment is very difficult. So what went well? So the team work and the communication across the business has improved. The Kaizen team were made up of many different remits, which enabled us to work together on a one-to-one basis. And this improved the communication across sites, and it was clear who to contact in regards to their roles within the process. Coming away from the COVID bank model means more informed candidates. It allows candidates to receive more adequate training for the role and also allows these candidates to receive the training appropriate to their role prior to their start date. In regards to keeping the show running, the teams working across the sites allowed for interpersonal relationships to grow, which improves overall future services and can only lead to improved recruitment days. We introduced reference checks during the interview and also a fact sheet for candidates to take away with them if they were successful. This allowed the candidates to be more informed when they was leaving, which has increased the references for the onboarding processes to be more efficient than previous recruitment days. Thank you. I will hand you back over to Martin.
Hello again. Learning is great, and the operational team have at times struggled with being able to put the amount of time into the project that was required to help the project move at a faster rate than was possible. A greater support from the home team at the beginning perhaps could have assisted in this process. We feel that some of the explanation of the roles and responsibilities could have been clearer at the outset, and also the amount of commitment required on top of the day job, we believe that was underestimated at the beginning. It is something that came as time progressed through the project, but it is on reflection something that could have been better if. There is a great need for the time to share, and especially if this project, as most stakeholders are not in the same team or even on the same site, and it hasn't always been possible to have that fast transfer of knowledge, information and input. A considerable factor to be better is the need for a dedicated venue to host recruitment events for facilities and estates in particular. We don't have this currently, and we have to rely on having people out of goodwill vacate offices and training rooms to allow us to conduct the assessment centres. This will have follow-on links into other projects that we're working on as well in areas such as facilities induction and refresher training. However, the real bulk from the blue has been the launch of NHS Jobs 3, and this has resulted in having to make significant changes to our recruitment processes that we'd previously mapped out, as the two systems, the old and the new, do not work in the same way. I'll now hand you over to Sophie.
Thanks, Martin. So the next steps for the team are to decide cut-off points for reference checks and a standardised way of shortlisting for success, and to continue the PDSA, the processes with the new NHS Jobs 3 that are in place and how we can work with that. The amount of work this team have put in is phenomenal, and whilst continuing to keep the service running and essentially running two systems in parallel. The hope is still that we greet our new starters in the Leeds way, and the team will be back in November for their 60-day report out. Thanks to those who couldn't make it today, and we're only a small representation of the huger Kaizen team, so thanks to them as well. I know Amna's on the call, and yeah, thank you very much. Any questions?
Thanks very much, Sophie, Martin, Claire. Great stuff. Really, really good and very, very encouraging. So, two really excellent report outs. A little bit of time for some questions in terms of what you've heard from Suzanne and Sandra on Bookwise, and then from Sophie, Martin and Claire on the 30-day report out on recruitment. So I think I saw Karen and then Paul.
So it won't come as a big surprise. So introduction, everybody. My name's Karen Ledgard. I'm the head of nursing for Outpatients, predominantly the adult services, although we do have some children's. So it won't be a big surprise to my question. Well, it's more of a comment for Suzanne and an ask really of Sandra. I think I would resonate with everything that both of you have said. So my office has got 15 Excel spreadsheets on the walls, all colour-coded, which are all of the outpatient areas that we cover, and have that same issue of what we think is happening and what really is happening and all of those sorts of things. So we're really excited to be following on from children's, and the project starts next week for the rollout into the adult outpatient areas, which is great. I think, like you, we are expecting to, and I'll be honest, open a can of worms, because I think it is going to uncover all sorts of things all over the place, but really exciting to see the patient benefit as a result of it. So well done for kind of starting that, and we will be knocking on the doors lots of times. Sandra, my ask of you is, and I'm kind of going to ask a bit of a favour. I have a number of Band 7 sisters within Outpatients who are a little bit mixed about whether this is what is the right thing to do. They are slowly changing that view. They've been very used to having that control, but lots of work that happens and phone calls and emails. So, Sandra, I wonder if we could borrow your expertise, either as a visit to one of our sister charge nurse meetings so that we can hear from you the nursing specific parts of things and what you've learned and what's gone well. But I think we'll also be knocking on your door a lot as well, if that's all right. That's fantastic, everybody.
That's absolutely fine, and I would love to meet with them. I was the same as them. I was really worried, and I thought this isn't going to work, and was pleasantly surprised. The big thing is, and it seems as though you've got that on the go anyways, communication. You know, keep the people on the ground level involved, because this is where it happens. The outpatients happens in the department. We're there all the time. I kept my team involved, and you know, kept the communication up, and it worked really well. I was like the go-between between my staff and Suzanne and her team, and it worked really well, very smoothly actually. Very
good. That's great, thanks. And I'm sure there'll be lots of productive conversations between you about this. So thanks very much for your question, Karen. Paul.
I'm conscious of time, Julian. So I just reflect. I thought both of those report outs were fantastic. I mean, on the rollout of Bookwise, I just want to be clear that there's absolutely no credit associated with the digital team. This has all been with the children's team for doing this. And the future rollout in Outpatients, again, is being done by the Outpatients team. You know, both kind of engaged with us to make sure that we knew what was going on. But they've really done this themselves. And I think, you know, a fantastic use of technology. What I really liked in Suzanne's comments or on the slides, there was some comments about we're not going to get it perfect, so don't everybody whinge. And I think that's great. I think that too often we can spend too long trying to turn something perfect, and it's never right. As soon as you put it out in the wild, you're going to realise there are things that could be done better and things that need changing. And I think I had an old boss who used to say, "Don't let perfect be the enemy of good." And I think that's a really, you know, what we've got at the moment isn't perfect, quite clearly. So let's get something out there that's a bit better and then build on it. So I thought, you know, some great work there. And then I was just wondering on the recruitment whether there's anything. You know, we don't in digital recruit at the scale of 300 people a year or whatever, but we do have quite a lot of recruitment going on. I just wonder if there's anything we can learn in the digital team from some of the things that have happened over in estates. And it'd be great to kind of hook up my recruitment team with that recruitment team and see if we can take any of the ideas forward.
Sure. Thanks, Paul. I don't know if Hugh wants to come in there. I think I forgot to link you in. Sorry, Hugh's the sponsor for the work.
Yeah, Sophie, thanks a lot. I'm Hugh Cummings, Head of Business for Estates and Facilities, one of the sponsors. It's been really good to see the team and how they've sort of worked together, communicated, improved communications, and to the results what we've got so far. It's definitely start of a journey, and we have had some big successes. The key thing for us, Julian, is that we're trying to make sure that the recruitment day sort of starts and ends the process of engagement for the new candidates. At the moment, we've seen the historical where people leave site and then they have to do the onboarding, and we're keen to give them the technology, give them the contacts so that the ID checks take place on that day, which was successful last week. So for the first time ever, we had support from central recruitment, corporate recruitment, to get the ID checks. It wasn't a lot, but we had 3 people that successfully did their ID checks on the day. And the more we can get that done on the day, the less there's the to and fro in, whereby people, you know, leave site and then you lose control of them, to be honest with you, at that point. So NHS3 jobs is a big issue, which I know people within the trust are working through within the recruitment team. But I think just picking up on your point there, Paul, what we'd be keen to do is sort of work with yourselves as well, and look at how we can work on some of the systems we use within the trust. And I know they're not down to the IT team to sort of, you know, they've not built them, but how we can continue to automate some of the processes to speed it up as well. So there's less manual intervention for some of the steps, like when we have to tell people to no longer engage in the process, just to automate that. So there's a lot of work we can build it out from the work we've done already with some of the other teams in the trust, which we're keen to do. But thank you to the team, because they've done a fantastic job so far.
Yeah, absolutely, Hugh. Completely agree. Excellent. Well, thanks everyone. That's been a really, really inspiring report out. Thank you very much to all of our presenters this morning, this lunchtime. Really great, Suzanne, Sandra, Sophie, Martin, Claire, excellent work. Please keep this going. Do come back to report out with further updates, and we want to support the work you're doing. And thanks everyone for joining. Please spread the word about report out. It's an important part of the week. It's a really good way to sort of work towards the end of the week, to reflect and celebrate on the great work that's going on amidst all of the pressures. And thanks everyone for participating. See you next time. Thank you.
Thanks, Julian. Bye.
Thank you.